Brian,
thanks for having me on. I'm excited to be here.
Yes. Yeah, I was going to say, the floor is yours. I don't want to take any of your time. I know you probably have amazing things for everybody, and enjoy.
Yeah, so I wanted to come on and just talk a bit through ransomware and the scourge and what's going on. And in the world of ransomware, unfortunately, healthcare is the number 3 this year so far, the number 3 sector that's been hit, at least that we know about publicly. All right. And then last year it was number 2. So construction always seems to be number 1 for whatever reasons. But I should digress before I keep going. Hi, folks. My name is Ryan, and I'm the author of SANS FOR610 Ransomware for Incident Responders. So it's a 4-day digital forensics course where I break down ransomware attacks from the planning stage to how they begin the attack and the whole life cycle essentially, and then the little in stuff down there. And we try to hit on all the different possible scenarios that you might run into in a ransomware situation. And unfortunately, there's an evolution to ransomware that we're seeing these days that is not favorable for anyone, really. I mean, why would it be? It's related to ransomware. So some folks may have heard the terms cyber extortion, or you may have heard the terms data theft extortion. So what that all comes from is, to pull back a little bit, like, what is ransomware, right? People say it all the time. There's a ransomware attack. There's a ransomware attack. Well, what does that even mean? So ransomware back in like 2000, I guess 14-ish, and a little prior to that, ransomware was more referred to as a locker. And it was essentially a malicious software, malware, the term malware, that would be sent like via email, typically like just attached to an email. And people would, fall for some silly ploy, social engineering, and go, oh, I have a package I didn't expect. Okay, that's cool. And go boop, and then click. And then their machine would essentially display a window that would say, hey, sucks for you. And then there were multiple different avenues, like this is the FBI, or this is, I found private files in your computer that you don't want leaked out, or whatever it was. But it would lock a single computer. And they were typically referred to as lockers. In fact, in the darknet forums, which is where a lot of the Russian-speaking, I should say, at least Russian-speaking, a high majority of them, ransomware threat actors, where they congregate and where they hang out, they still refer to ransomware these days as a locker. And that's from that old school term, locker, where it would just, window would come up and you couldn't use your computer, your one computer. So that was a threat that wasn't good. It was more on the personal level. It was kind of wide net approaches. They'd throw that net out and just, mouse spam, malicious spam the entire freaking internet, every email address they could find. The evolution of that came to, well, some threat actors realized, instead of just locking one computer, why don't we lock an entire organization? And how could we do that? So what they did is they adapted the methodologies, the techniques, tactics, and procedures, or TTPs, that we sometimes refer to as the way that what we had referred to previously, advanced persistent threat, or APT, which is usually like nation state sponsored. I won't name the big countries, but you all know what I'm about to say. So those styles of attack, they have a reconnaissance phase. They have the initial infection vector, like where they get in, initial entry, initial access. Once they get in, what do? Well, they carry out their espionage attacks, right? And they do it by doing all kinds of fun stuff. They get in through a typical user account, hopefully not your user account. When they get into those accounts, what they do is they elevate their privileges. So if I'm working IT at a healthcare organization, and one of my general employees gets phished, for example, right? They want to get my credentials because I have the keys of the kingdom, right? So that's called a privilege escalation. They want to escalate their privileges, and then they want to move around the environment. Why? Well, because they have actions on objectives that they need to reach, right? And those actions that they want to carry out these days are not just to deploy ransomware, but to also steal your data, right? We call it data exfiltration, to steal your stuff, right? So the ransomware actors came up with this idea, well, why don't we just go in, carry out the attacks just like those folks do, but then at the end of it, deploy ransomware? And so that was the birth of human-operated ransomware. I refer to it as humor, H-U-M-O-R. Humor. It's not humorous, but it's human-operated ransomware. So that was like a whole new ballgame, because now we're not talking about, APC like at a nursing station that goes down, right? No. We're talking about the entire hospital going down, or the chain, or the campus, or whatever it might be. From there, ransomware developers realized, wow, this is super, super successful. This is awesome. How can we make more money and make more people miserable? And the way that they did that is they thought, ooh, I know. We'll make it like a multi-level marketing. And essentially what we'll do is we will lease out the product and we'll have other people go sell it for us, right? Sell it. What does that mean? It means that a core group of developers, apparently a core group is a fist for me today. That's the core group here, would develop the ransomware and maintain the infrastructure for the malware itself, like the malicious software that would come at the end of the attack. And then they would write out these playbooks and it would just be like, step 1, do this, step 2, do this, step 3. And then they would hire affiliates. And the affiliates would be just like the people who are knocking on your door, the old Avon days. Well, in the United States, Avon was a beauty company who used to send people around and do all the legwork, if you will. Were the people, they were called originally Avon ladies, I think was the term, Avon marketers, whatever it was. And so the idea for ransomware was we're going to have this core team and then we're going to hire all these different people, right? Sometimes some of those groups will literally hire them, but these days it's more you just kind of come on board. Sometimes you actually have to lease the software. Essentially, you pay a leasing fee, if you will. But then your job is to essentially follow your playbook and the one that the core group provided to you, get into an environment, carry out the attack, and then deploy the ransomware. But you don't have to know how to write ransomware. You just need to know how to follow a playbook and attack an organization, which unfortunately is very, very easy. By the way, in healthcare, the average that I last saw was around 6% of the IT budget goes towards security. That's horrible. That's not good. That's a bad look for the industry. And going towards the whole securing the patient thing, like we need to fix that. Anyway, so that became known as ransomware as a service. So the idea behind that was that anyone can get involved in the ransomware game, right? So these ransomware attacks that we've started seeing that just started proliferating since 2016 and just going up, like up and up and up and up and up. They got exponentially worse in 2019 when a group called Maze, like, you traverse a maze or try to solve a maze. They came out and they were like, wait a minute, what if instead of just, destroying all your stuff and wreaking havoc, right, for your patient care and everything, what if we also steal a bunch of your data and then hold that over your head, essentially, or whatever that was, hold it over your head for extortion purposes. So it was multi-levels of extortion. One was, well, do you want your network back, as in your hosts, your computers, because you can't use them because they're encrypted and you need our key, right? That's extortion level 1. And then the second stage of extortion was, oh, and by the way, we have a bunch of your data. And if you don't pay us, we will release that data to the public, or we will sell it on the dark net, or we will do both, or whatever it might be. So that's where we've come now. Sitting here in 2023, we have a situation where healthcare, just in general, the IT budgets do not really allocate a whole lot for security. And yet ransomware is going up and up and up and up and up. There was this pervasive thought in the industry that ransomware was going away, that it was dying, especially in like early 2022. No, not at all. No. Ransomware is extremely prevalent these days. There are many, many groups who are ransomware as a service groups, and there are many, many other groups who dedicate to specific verticals and sectors and try to compromise them. So a ransomware attack is usually what's called an affiliate, will come into your environment. And sometimes they don't even have to get into your environment themselves. They use what's known as an initial access broker. That's an entirely separate realm of the threat actor community, but very tightly integrated with ransomware these days because they work very, very closely together. Their whole job, all they do, 9 to 5, and many of them do work like a 9 to 5. You'll see their activity spike like this if you're tracking their activity, like on a personal level, So their job is to get into networks. And they love to get into healthcare. They love to get into hospitals. They're starting to get into plastic surgery centers. They're doing all these crazy things. Are they really? No, they're not. The initial access brokers are exploiting what I refer to as security 101 failures. And that's what I'm trying to get across here, especially for this forum, is that a lot of these ransomware actors, what they're not doing is using the latest, greatest, craziest tech out there in the world. They're not doing that. I mean, first off, some of them are. Sure. There's you may have heard of the Move It vulnerability. There's software called Move It, and its purpose is data warehousing and data management, essentially. It's file storage, right? At the base level, right? So there was a 0 day, as in like no one knew this was a possibility to run this particular exploit. And they leveraged that. A group called CLOP leveraged that. CL0P is their name, CLOP. They leveraged that and hit hundreds of organizations because they were able to just log into their cloud-based file sharing, their file sharing stuff, and go, "Ooh, this is all your data, yay!" And they just ripped it all off. They didn't encrypt. They just stole all the data. And there were a number of different healthcare entities involved in that, right? So that's a 0 day. That's bad. How are you going to plan for that? You got to kind of plan your response really for that. And you can protect the organization as much as possible should any of your commercial services, have something like that. But that's not what normally happens, especially in healthcare. What normally happens is the threat actor will phish someone associated with the healthcare entity or organization, or they will just do what's referred to as brute forcing or credential stuffing, as it were. We all think that we have these crazy, unique, special passwords, and I really, really hope that you watching right now that you do. But many people are using things still like, what month are we in right now? Where am I? What world is this? 2023, September. All right, so they'll be like fall 2023 exclamation point. They're still using those types of passwords. They, being like your employees, are still using those types of passwords. By the way, for any IT folks on right now, there's a mechanism called passfilter.dll in the Windows environment. It allows you to filter out certain passwords. It's not super granular, but there are replacements for it. You can stop your employees from using super silly things in their passwords, like the names of months, the names of proper first names, the names of the seasons and things like that, and the year for that matter. You can get a pass filter replacement. Look that up for IT folks who are on right now. Okay. So these threat actors are just taking passwords and just throwing them at a bunch of remote services at hospitals and healthcare centers and surgery centers. And then boop, they get into a machine. Ooh. And once they're in, from there, it's essentially game over, right? So all these security 101 failures are things of like not setting up MFA properly, not multi-factor authentication, not having it, or using MFA that is tied to a phone. So if you have MFA, you're going to most likely have it on your mobile devices, right? Some type of like, yes, that's me, boop, right? After you put your username and password in. If you're using text-based, also known as SMS, if you're using SMS MFA, the ransomware actors these days are implementing attacks that are known as SIM swapping. So not these CDMA phones, but a lot of phones have what's known as a SIM card. And the card is basically your account, right? That's your account. So those cards can be transferred between phones, boop, 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 and they can be swapped is the term. So a threat actor can get your username and password. And let's say that you do have MFA set up in your healthcare environment. However, let's say that it's all text-based. Like it just sends a text message and says, hey, was this you? Type yes, or put this number in, or whatever it might be. Well, the threat actors have this vast network now, and I mean vast, okay? If they want to target someone, they'll find me. They'll find that I have a phone via, I'm not going to say it even. I almost said my provider, like let's not give them more information than they need. But they'll find out who your mobile provider is, and they'll swap that out by either calling and manipulating them, or they actually have people on the payroll, like a decent number of people on the payroll. I'm smiling, but it's not a good thing. It's a very bad thing. And they'll just swap the phone. So they're essentially, you have your phone in your hand, right? But all of a sudden your phone, your account is transferred away from your phone and into a phone that's in their hand. They have a whole ecosystem. There's multiple levels and roles. One person's the holder. They actually hold the phone physically. One person calls. It's a whole thing, right? And ransomware's starting to use this now. My whole point to this is if you're using MFA that uses SMS, stop it. Stop it, because they're starting to get into large organizations because of that. So be careful for that. And we're seeing it impact healthcare. Another place that we're seeing some problems essentially is when you have your users who have their own phone. Like this is my personal phone, right? I have a work phone over there, but I have a personal phone. Many people use like one phone, or they'll have a work phone, but it won't be your phone that you gave them, that your IT department gave them, and it won't have mobile device management on it and lock down and have a VPN connection that's always on and be secured against stupid links that someone might send out. Rather, you probably use a BYOD, bring your own device, right? And that means that people just go buy a phone. Usually they'll pull one out of the drawer, like last couple of years phones or whatever. And they'll be like, this is my new work phone. when they use those types of phones, the threat actors know that you don't have much visibility into that darn phone. So, excuse me. So what they're doing, sorry, is they're phishing via the phone. So they're sending SMS text messages to your employees. And it's very, very easy, especially in healthcare, by the way. Very, very easy to get doctor names. And I mean, just think about how much of your practice, whatever it might be, is out there with, oh, you need to get a hold of our scheduling desk or Dr. So-and-so, or and it's like, oh, it's really easy to get your phone numbers. So you have to be very, very careful for your users and do employee training, especially in healthcare, to avoid having people fall for phishing via the phone. I'm getting them more and more just in general. I got one yesterday. I think I might have it still active here. I can randomly just talk through this. Yeah, here it is right here. I got a random message. The USPS package has arrived at the warehouse and blah, 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 blah. And it's like, the link is not active because my carrier tries to protect me. So it even says like, reply to this message, close the text message, open it back up, then click the link, because then it would be active because I've interacted with it. No, I'm not going to do that. And make sure your employees also don't do that. All right. It's very important. These are some of the new threats in ransomware that we have to worry about, right? SIM swapping. How do you stop SIM swapping? And how do you stop the entry vector of that methodology for your healthcare environment? Well, it depends. If you're using BYOD, the onus is on your employee, all of your employees, better yet. And that's a bit of a persnickety situation. So what you might want to do is train your employees to call their mobile providers. Now, will they do it? I don't know. Can you make them do it? No, but you can ask them to do it. And they can call the providers and ask for two different types of passcodes or PINs. One of them is a passcode that's just referred to as account access, typically. Like all the big providers in the United States and other countries, all the big providers will usually offer some type of passcode you can put on the account. So you have to give it verbally or maybe teletype it in, whatever, so that you can't even access the account without it. There's oftentimes, however, also the ability to set one for transfers, which is what a SIM swap is, right? When your phone just becomes not your phone and just an empty little husk, essentially, right? So you can train your employees like, hey, can you, everyone just call your provider and ask them, put a passcode on the account. Don't let the account be transferred unless I give you this specific passcode, phrase, PIN, whatever. Now, I did mention they have people on the payroll in the ransomware gang these days who will just do a SIM swap. They don't care if your account says, don't change this, don't transfer it, because they're doing it illegally anyway. They don't care. So it's very difficult to deal with in that regard, but it's still, an extra level of protection, if you will. All right. Another thing I want to talk about just in general for ransomware and healthcare is we're starting to see a lot of, unfortunately, protected health information, PHI, that is going out the door and then is being leaked, like legitimately leaked out, right? So if I do, I was going to say if I do some math, I'm not going to do math. I'm going to just walk you through something here. Knowing what attacks are actually occurred in the ransomware realm, all the attacks, no one knows that. That's not possible, right? Knowing, however, what attacks have been publicized, that's one thing. But also knowing what attacks have been publicized by the threat actors, that's another thing. So I have a link that I'm going to give out in a second here. Please be careful for anyone who's not in the IT realm. Don't go to this link. And for anyone who is in the IT realm, be very, very careful when clicking around here. Okay, but if you go to, and they're going to pop it on the screen here, FOR528.com. That's my class name, right? So FOR528.com/R-gang, R like ransomware, and then gang like they're the dirty gang, right? So if you go to that URL, there's a listing of a number of trackers where you have people who scrape all the data leak sites of the various threat actor groups and give you kind of like an overview and statistics and things of that nature. So one of the ones that I love the most, it's called ecrime.ch. It's the only one, by the way, full disclosure, I'm buddies with the guy who runs the site. It's the only one that's not free. It is a paid subscription. So I'm just throwing that out there. I'm not trying to hawk his wares. I'm just saying it's the one I rely on, and I'm about to give numbers from that site right now. So the threat actors, when they release data, what they do is they go onto they'll call it like a blog or their website, or they'll call it their darknet site, but we all refer to those collectively as a data leak site, a DLS. they'll go onto their DLS and they'll say, all right, we just hit so-and-so. And I don't really want to mention some names right now because I always feel bad like giving new victim names on these streams. Like, oh, guess who else got pwned? Like, that just feels bad. But I'm looking at it right now. I'm looking at the e-crime. There's a couple other ones out there, Ransom Look, Ransom Watch. They're for free. Just click them at the top of that link, that /rgain link site. So I'm looking at healthcare, and I see some of the various categories like hospitals and healthcare, medical practices, pharmaceutical manufacturing, mental health care. That one really irks me. And we look at this year, so year to date, right? How many attacks have there been that have been reported by the threat actors themselves? And it's 240. And if I look at this number of those, 43 of them were a group called Lockbit. Lockbit 3.0. They version themselves because they evolve and get better, which sucks for all of us. So Lockbit has hit a number of these groups. Alf VM, also known as Black Cat, has 27 thus far this year, and Clop has 27. I believe almost all of those Clop ones were that Move It vulnerability, technically. So looking at the numbers and looking at, you can't see it right now. I know that. I'm looking at the screen here. But, the employee sizes, a lot of people also think that medical practice sizes that get hit by ransomware are these big gargantuan, like the Anthem and things of that. Well, not necessarily. In fact, I'm looking at a list right now. Employee size for a victim from today, 2 days ago. Sorry, I forgot what day it was. Employee size 2 to 10. Employee size 2 to 10. Employee size 11 to 50. Employee size 11 to 50. The very next one, up to 10,000. Like, they're all over the place. They hit so many organizations. I've worked ransomware cases for dentist office. I mean, like all over the quote, the medical field, essentially, in healthcare. One of the things that really is problematic is this evolution to not encrypt the environment, but just steal the data. So I'm referring to that like in my course going forward because the industry doesn't have a de jure standard, right? There's no law written that says we call it this. We didn't all agree on something. I'm going to go with just cyber extortion, right? So you have an attack and they steal your data and then they leak that data out. Now, out of this almost 300 or whatever we've had this year, what are we seeing? I don't want to mention specific organization names. I don't like doing that if I can avoid it. But I will say my wife works in healthcare. She works in the beauty industry, right? So she works, she's worked at a number of plastic surgery centers and things of that nature. So one time they were doing training and she asked me, can you come in? The doctor's having some outside person come in. They just want to do like a consult, but with you. And I'm like, sure. So I go in and I'm standing there and within like 2 or 3 minutes, he's like, all right, go ahead and take your shirt off. And I'm like, whoa, I'm just helping my wife. Like, what's happening here? So all of a sudden they're taking pictures and I'm like, whoa, who's protecting this? Like, who's your IT person anyway? And they're like, oh, he comes once a month. We got a guy. His name is so-and-so. I was like, what? What? And you're putting weird pictures of me? Like, no. So I thought that was funny at the time. But what's not funny is those exact things have been leaked out, and very recently, by the way. So I don't want to mention specific organizations or group names, but we're seeing before and after of medical procedures. We're seeing before and after of like surgeries, and just think about I don't even want to think about it. A lot of the things you do, the last thing you ever want is your most vulnerable self out there, whether it's in text format or literally pictures of that vulnerability, and those things are being leaked out because of ransomware. So to kind of wrap this up a little bit, I've got another, I think 6-7 minutes or whatever. I think that in the healthcare community, there's not enough understanding of what ransomware is, right? So what is that leading to? It's leading to not enough protections around ransomware. And what are those protections truly? It's really what I call security 101. It's good password hygiene in the environment. If you can enforce it at a technical level, you can tell your employees, hey, don't make your password something stupid like the month, the year, and your name. Like, don't do that. And they'll go, okay, I won't do that. And then they'll be like, and then they'll go do it. If you could stop them from doing that, look up PassFilt for you IT folks. Look that up. Also, if you can stop having so many services exposed to the internet for you IT folks, right? The more services you have exposed, the more the more exposure, like that you have, right? And the other thing about that is, I think I digressed on this part earlier. The threat actors are not really using these 0-day things; they're using general vulnerabilities. I have a listing of, I don't know, 20, 30, something like that, common vulnerabilities and exposures. It's CVEs is what they're referred to as. And they are like when a software provider, hardware provider, whatever, comes out and says, hey, we made a boo-boo. And it turns out that there's this vulnerability where someone could just remotely log in without ever knowing a password or, whatever, right? When they publish those and they put a patch out, right? And you're supposed to patch your software. You know who doesn't patch their software? I'll give everyone like 2 full seconds to guess. Who doesn't patch their software in this world? Everyone. Everyone doesn't patch their software. It's ridiculous. When we say patch, the reason we're saying that is because when the threat actors see these things come out, they are downloading the exact patches that are fixing the problem. In the medical community, you have so many devices on your networks, including like Internet of Things. You have all these different devices. You got blood pressure regulators and all these things that are pumps and all kinds of things I had to deal with recently in some cases. And they're connected to the internet, and you're not updating those. You're not checking with the vendors, and they're just sitting there. They're just sitting there. And when they become vulnerable, they're just sitting there. And you have your firewalls and your VPN, virtual private networking, is how you connect remotely into your office sites, right? Remotely, hence I said remotely twice. Those services are there to help us and to ease our daily computing lives, but they will make them much, much worse if we don't also stay up to date and patch those. So whatever go back to work, or unless you're there now, you're remote. Maybe you're at work now. Hi, I'm in my office. I'm not at work. This is my fun work. So if you have that situation where you can go back and say, hey, what's our patch cycle like? If you hear anything over 30 days, very politely tell them no, no. So 60 days, 90 days, 120 days, the threat actors are downloading the patches that all these different vendors put out. Those patches specifically seek out the vulnerable code, and then it fixes it. So what does it do for the threat actor? The threat actor goes, okay, where is it going? Oh, it's going to that line right there. That's the vulnerability. Okay, thank you. And then they're exploiting it, developing exploits. So, all right. Again, some of the things we're seeing in healthcare that I want to mention again, that's allowing ransomware into your environments and causing this data leakage of your most private and sensitive moments and things of that nature, is there's a big shift to phones. So be careful. MFA, you should have MFA on all the things. All right. If you are an employer, like I don't work in IT, but I'm here, that's fine. Awesome. Thank you for being here. But please go back to work and take note of when you log into systems and services, are you putting in your username and password and then that's it? You just log in? Like that's it? Yeah. If so, that's bad. Talk to someone. If you don't even know who to talk to in IT, talk to your manager. Put the onus on them. Like, hey, you're my boss. This is a problem. So you want to have some type of multi-factor. If that multi-factor is a text message, right? Just a text message, that is still a problem that needs to be fixed. The alternative to that, by the way, is usually referred to as a push, an application that is installed on the phone that is configured, initially set up, and will not travel with the SIM. If there's a SIM swap, it stays on the phone itself. That's the alternative, by the way. I neglected to mention that. Okay, so be very, very careful of your phones. You don't want to end up in a situation where you have a threat actor come into your environment and encrypt it, or even just exfil your data. Because just so folks are aware, I've worked cases and I have a vast network, which probably doesn't surprise you. I like to talk a lot. Can you tell? A vast network of online cohorts and buddies that do the same thing I do, which is incident response. That's my day job, by the way. I'm the one who comes in and goes, uh-oh, and helps you clean things up, get them out. What we're seeing is that even if a threat actor comes in and does not encrypt, the amount of cleanup and the cost of that cleanup to deal with rebuilding all of those hosts, resetting all those passwords, ensuring the threat actor can't get in the same way. You have to find out how they got in. Like all those things, heck, just the tab for us, incident response, and make sure you have cyber insurance, by the way. I recommend it personally that you look into that if you don't have that. It's massive, and there are many groups and entire campuses that will go down even if they're not encrypted, because they have to be brought down on our recommendation. I often will recommend, yeah, you need to go dark. You need to kill all internet. You need to stop this now, or you're going to get encrypted. And imagine me going into a hospital environment and saying that. People are you mad? And I've done it many times, and I've had people do it many times. So you don't want them to get in. Do a little bit of research on some of the initial access brokers if you're wondering how people are getting into your environments. And I just want to say, I've got another minute or two here. You know, I'm very happy to have been able to just kind of yammer on about ransomware and some of the newer things we're seeing and really what it is. I hope that I helped out a little bit. If there's any questions, I think I see my comments over here. Click. Now I saw them. Cool. I saw them at the very end. Good job, Ryan. I'll tell you what, I'm going to reply to some of these in the chat because I failed to do it while I was talking. That's what I should have been doing. That's all right. So yeah, I'll leave it at that. Obviously, I've got a lot more to say. You can find me on, I'm still on Twitter or X. Yeah, I don't know who's still on there, but I am. I'm RJ_Chap. It's actually right there on the screen. Boop, right there. So you can hit me up there, add me on LinkedIn. If you have any questions, you want to talk about some things, any emergent needs, whatever it might be, I'm around. And to the crew who's hosting, if you want to pop back on, I'll invite you back on. Hi.
We just materialized, Ryan. Thanks for bringing us back.
We booped in, if you will.
I just wanted to say thanks for having me. And for everyone out there, you know, seriously, discuss security in your organization with whoever you possibly can, because we're not putting enough into truly securing the patient. Because in my mind and in SANS, that I'll speak for all of us, securing the patient includes IT security. I got befuddled just trying to think of other ways to say that. So yeah, go do that.